Okay, so if somebody comes in to see you and they say, I can't concentrate, I fail all my exams, I keep losing my job, and I keep butting into conversations, it's relatively easy to home in on that this might be a primary concentrational problem. But not everybody presents like that, and that's where familiarity with the condition is important. I've already said that people quite often present at certain key points in their life, but the way that sometimes people present is with, first of all, hidden ADHD, it's perhaps best called. They may present with depression, lack of self-esteem, lack of confidence. They may present with anxiety, a history of long-term failed projects. A classic presentation, nothing I ever do seems to work. I start off with enthusiasm, but then I lose interest, and I've got 17 failed projects. Nothing ever seems to go through to fruition. So anxiety and depression is quite a common masker for ADHD. And so I quite often see people who've been to see numerous doctors, GPs, psychiatrists, and had a variety of treatments for anxiety and depression, and they've had no effect on their primary problem. In fact, there's some evidence that some antidepressants can make ADHD worse because they tend to focus on serotonin, which pushing up the serotonin levels in the brain certainly have an effect on mood, but it's a bit like a balancing effect that you can get an apparent relative decrease in the tonality of dopamine and noradrenaline. So sometimes antidepressants can actually make concentration worse. There are some antidepressants, Prozac being one of them, and some of the more complex antidepressants which can actually help with ADHD. But the standard SSRI type antidepressants such as sertraline or citalopram often make things a little bit worse. The other way that people sometimes present is with impulsive behaviour, gambling, drinking, drug taking, crime, impulsive aggression. This makes things really difficult, particularly if there's a history of drug taking, where I do see people who are self-medicating, who are using stimulant treatments illegally, cocaine, amphetamines, and to a certain amount, although it's not a stimulant, ketamine actually has, in certain dosages, has dopaminergic releasing effects. Now that makes things very complicated because you've got a problem with addiction or abuse, and it's actually about trying to demarcate what is to do with the underlying condition and what is a secondary effect. So that can make things quite complicated. The final way in which people present is with comorbidity. So in other words, this is not hiding the ADHD, this is working alongside. And with neurodevelopmental disorders in particular, they're a bit like Velcro, things stick to them. So you tend to see with ADHD other neurodevelopmental disorders such as dyslexia, such as dyspraxia, which is where the cerebellum comes in, and also variants of autistic spectrum disorder. I see quite a lot of people with mild autistic symptoms, particularly Asperger's-like symptoms in which they find interpersonal relationships difficult. They tend to rote learn, and they try to overcome their inattentiveness through obsessional type thinking. Now, autistic spectrum disorder is more complicated, but there is some evidence that in some people with comorbid autistic spectrum disorder and ADHD, treating the ADHD actually helps with the interpersonal relatedness because they're more focused and it tends to make them a little bit more confident. But it is a complicated area.